talk about the use of topical oxygen and sort of how it integrates the oxygen as well as the compression in a moist wound environment. From a objective perspective, we're going to talk about and understand the role of oxygen in wound healing. We're going to review how you can incorporate compression with wound healing with topical oxygen, and then differentiate between the benefits of topical versus hyperbaric chamber. So in order to get wounds to heal completely, we have to look at all the different factors, the things that we talked about this morning about nutrition. We have to look at what is available for us. Now, when I was in the wound care setting a number of years ago, topical oxygen was relatively new. They were small devices. They were just pumping into the wound dressing. I didn't find them particularly effective. Topical oxygen has evolved significantly. The devices are reusable. They're portable. They can go out to the patient's home. The patient doesn't have to worry about coming to the center. It's going to use a disposable chamber that is going to incorporate very high levels of tissue oxygen and a graduated compression. So typically what we're looking to do is use these cylinders. We're going to get graduated compression. We're going to get better wound healing. There are no complications, none of the contraindications that we had in hyperbaric chambers, and we can use it for diabetic, we can use it for venous and pressure ulcers. We can also use it post-surgery. That's the way we use some of the other devices we've had. We look at this diagram of the wound, we can see in the center of the wound, the oxygen level is very low. Most of the time it's less than 10 millimeters of mercury at the center. We can see as we move closer, we might get closer to 60, but overall, we're not getting the oxygen to where we need it. We need granulation tissue, we need the leukocytes, we need the collagen to form, and if we don't have oxygen there, we're not going to be able to get the wound to heal, and we're not going to be able to get the good quality healing that we're looking for. So, does the topical oxygen diffuse through the tissue of the wound in humans? So if we look at this study, we can see the chamber, and we can see pre-treatment oxygen levels are very low. And in these cases, you can see the post-treatment levels are up much higher than where they were and much more effective. And you can see in this particular patient, this is a wound that lots of us are fighting with, this diabetic ulcer. It was debrided, and with the oxygenation, you can see a nice beefy granular wound that we're going to be able to get to close.